Okay, in this video we are doing a neurological screening of the motor systems, starting with the upper extremities first.
With the upper extremities, we're going to have the patient pull their forearm towards the shoulder. The examiner should grab the patient's wrist for resistance, testing both arms separately for strength. Extension is tested by having the patient push their forearm towards the examiner while the arm is still bent. The doctor is going to document the presence or absence of an abnormal response and the symmetry between the left and right sides.
We are symmetrical and intact.
Now we're going to test the pronator drift. To do this, we're going to ask the patient to hold both arms forward, palms up, and close their eyes. We're going to maintain this position for 30 seconds. And then we're going to have the patient's arms pushed briskly downward. Patient's arms should return smoothly to the horizontal position. This requires muscle strength, position sense, and coordination. Next, we're testing the lower extremities. We're going to look at the flexion and extension of the lower leg, similar to what we did with the arms.
Okay.
So now we're going to pull for resistance, both legs individually, and then we're going to have the patient push against, looking for symmetry and a positive response.
Symmetrical.
Next, we're going to do the Romberg test, which is a functional test of position of sense. The patient is going to stand with their feet together and eyes open for 30 seconds. They're going to maintain this position, and then we're going to have them do the same with their eyes closed for another 30 seconds. We're going to note the patient's ability to maintain an upright position. In ataxia, due to loss of position, sense vision compensates for the sensory loss. And open in this test.
There's a little bit of sway with the eyes closed, but she maintained good positioning with the eyes open, so we have a positive Romberg.
So next we're going to do the sensory cortex testing, starting with testing the different dermatomes.
Now we're going to test the dermatomes for pain sensation, and our patient will close their eyes, and she will decide whether the pain she feels is sharp or dull.
Dull. Sharp. Dull.
Intact.
Next, we're going to test our patient's ability to discriminate temperature. So have our patient close their eyes, and then present them with a hot or a cold object.
Cold. Hot.
Intact.
Next, we will see if our patient has the ability to feel light touch. So have the patient close their eyes, and then lightly touch them with something like a cotton tip applicator.
My forehead.
Good.
My forearm.
Excellent.
My right foot.
Excellent. Intact.
You could also test vibration and position with the sensory testing, but since the pain testing was normal, we omitted those for this time.
Now we will test discrimination sensation. You will present the patient with two different objects with her eyes closed and have her identify what they are.
It's a dollar bill and a coin.
Intact. Next, we'll be testing the spinal reflex arc, starting with the deep tendon reflexes.
First, we're going to start with the patellar reflex. The patient's going to sit with the lower legs freely suspended. We're going to find the patellar tendon just below the patella and briskly tap it. Note the contraction of the quadriceps with extension of the knee. Contraction can also be felt on the patient's anterior thigh. If you're unable to elicit the reflex, may attempt to do the Girsky maneuver, clenching the teeth and interlocking the fingers. Next, we're going to do the Achilles reflex. We're going to have the patient somewhat flex their knee and dorsiflex the foot at the ankle. We're going to strike the Achilles tendon, and you can watch the foot for the plantar flexion at the ankle. Next is the biceps reflex. So we're going to support the arm in your own such that the thumb is resting directly over the biceps tendon. Place your thumb or finger firmly on the biceps tendon and strike with the reflex hammer so that the blow is aimed directly through your digital toward the biceps tendon. You're going to look for contraction of the biceps or flexon of the elbow. Next is the triceps reflex. We're going to support the upper arm and have the patient hold their arm limp. You're going to strike the triceps tendon with your thumb over the tendon. So next we're going to do the brachioradialis reflex. We're going to have the patient's arm rest on their abdomen or their lap with the forearm partially pronated. You're going to strike the radius about 1 to 2 inches above the wrist and watch for flexon of the hand. Next is the plantar response. With an object such as a key, we're using a cotton tip. You're going to stroke the lateral aspect of the sole from the heel to the ball of the foot, curving medially across the ball. As you saw, this was a normal response, which is a flexon of the